joining us. It's an opportunity for us to provide some timely answers to your questions 3 times a week. This is being recorded. If you're not speaking, if you can just mute your mics. We try to have a representative on a timely subject, and happy to have Dr. Mark Pandori, who is the director of the Nevada State Public Health Laboratory. In the chat, you'll see an announcement when Dr. Pandori was hired back in December 2019. So that'll give you a little background on his credentials. We asked Dr. Pandori to come on and just provide an update on how the testing is going and clear up any misunderstandings that may be out there. So, Dr. Pandori, appreciate your time and welcome.
Hi, sure. Thanks, Adam. Yeah, so right now at the Nevada State Public Health Laboratory, the ability to test for COVID-19 disease remains quite high. Regardless of what you hear about testing shortages, our state lab is well supplied with tests, and we can do about 400 tests per day. That we also are producing what are called collection kits here at the Nevada State Public Health Lab. So while there's lab testing components, there's also a collection kit component. And what that component is what's used to collect the specimen that eventually comes to the lab to get tested. And while there have been shortages of those out in the community and also around the United States, it's also been a role of the public health lab to not only test specimens that come to us, but to produce those collection kits. So if there's a clinic or a hospital or a testing agency of some kind, or a health agency, of some kind out there that wants to do testing, we're happy to do what we can to try to provide these collection kits to you. We have several in stock here and now. And the University of Nevada, Reno School of Medicine campus, where we reside and where the lab is a part, is also producing these kits in furtherance of testing. So it's just a reminder, however, that while testing capacity is quite high here, an individual cannot order a lab test through the public health lab. Still, by law in Nevada, a lab test has to be ordered by a health district employee or a clinician. That would be like a doctor or a nurse practitioner. So if a test is warranted, that would still be something that would have to go through a clinician or a health district. That can't be ordered from me personally or from anybody in our lab. And while the test that we order is what we call a molecular, or it's a test that detects the virus itself, there's also other testing coming to our lab in the next week or two, which will allow us to perform antibody tests. But again, that's no different from the virus test in terms of how it's ordered. It's just very different in terms of the information that it will provide. And that's an update on testing here. And I'm really happy to answer questions when that part comes up.
Great, thank you. Any questions for Dr. Pandori? Just identify yourself and who you're with. This is an opportunity to ask questions on how the state is processing the COVID-19 tests.
This is Kenzie with News 4. Just want you to delve into the antibody tests a little bit for anyone who might be unfamiliar with those.
Antibody testing ascertains whether or not a person has antibodies to the COVID-19 virus, SARS-CoV-2. So what the test does not do is an antibody test won't tell you if you're currently infected, because it takes a certain amount of time after infection for a person's body to make antibodies. So if you had a negative result on an antibody test, it could be that you're infected, but you haven't started to make antibodies yet. If you're positive on an antibody test, what it says is that your immune system, your body, saw the virus, and which means you were infected with the virus at some point. Maybe you didn't know it, maybe you were symptomatic. But then after you were infected, your body made antibodies. And now that's a marker that tells us, likely for the rest of your life, that you were exposed to the virus. What the antibody test doesn't say definitively is whether or not you are therefore immune to future infection. We believe that having antibodies means that you are resistant to being infected again, but we do not have hard data yet to say with certainty that that would be the case. So to summarize, the antibody test tells you whether or not you've had an immunological reaction, that is, that whether you've been infected with the virus, It doesn't say whether you're immune, and it doesn't say whether you're currently infected. The other test that we run does tell you whether you're currently infected with the virus because it detects the virus itself.
Thank you.
Hi, this is Siobhan from the RGJ. How are you going to use the antibody test? How is that going to be rolled out here in Washoe County? Who's going to be tested? How are we going to use that information?
None of those decisions are mine at the lab. What I can do is make the test available to doctors or clinicians and to the health districts. And then it will be up to the doctors and the health districts to determine how that test will be used. What I need to do is make sure that those tests are available and that they're run correctly, properly, and accurately for the clinicians and the health district.
Could it be, just in your experience as a person who does a lot of tests, could this be a game changer in terms of coronavirus in the future?
Game changer is a tough one for me to say. It's a game changer in terms of what specific question you're asking. From a public health surveillance perspective, that is trying to gather intelligence about how much infection is out there or was out there, I would think it's fair to call it a game changer because it's going to provide public health with a very powerful tool to at some point determine how much infection was really out there. In terms of medical response to this, I wouldn't call it a game changer because, like I said, it doesn't tell you anything about what's current about a person's health condition. It really only says what did happen to them. So public health is going to value a lot from antibody testing, but I'm not sure that necessarily the medical reaction will.
This is Kenzie again with News 4. From your point of view, how do you determine who gets the antibody test? Someone who had symptoms in November, December, or how do you judge that?
Well, it's not trying to evade the question, but as a laboratorian and as a person who operates a lab, I actually don't make that determination. Doctors and clinicians will make that determination, and public health professionals would. And I don't know how they're going to determine who gets tested and who not. One thing you might imagine at some point possibly is that people that need to work on the quote unquote front lines, like healthcare workers, it might be very useful to know whether or not they've been infected or have had an immunological reaction, because sending them back to work might be critical as we continue to face the challenges, both medical and public health, for this virus. So it might be that with limited antibody testing available on the outset, that we would have to ask, okay, is this antibody test result going to have any real impact on your performance in launching our counterattack on this virus? And so maybe for healthcare workers or for public safety or for people that have to interact with the public, we might have to think more carefully about testing them. But for a member of the general public, I don't know. That would be totally up to their doctor to determine whether it's important to know that or not.
Hey, Dr. Pandori, this is Sam Gross from the Reno Gazette Journal. Can you tell us how these tests, the antibody tests, are administered?
Well, there's really two forms of antibody test out there that you're gonna, if you haven't seen them already, you'll encounter them. And it's the same thing for HIV and for hepatitis C as well. You've got the point of care rapid tests. They look like a little plastic cartridge, and those are what are called waived, and those will be available, at outreach centers or wherever patients might be. They don't necessarily have to be in a doctor's office. And that will be like a little cartridge, what we call a point of care test. And that would be with a finger stick of blood. Then there's going to be antibody tests that are lab-based. And that's the one that I can speak to in terms of the Nevada State Public Health Laboratory. And those tests will be run on machines and equipment that are reserved to laboratories. And to get a test in that format will require that a clinician draws blood out of your arm. So those are the two angles that or trajectories of antibody testing that you're going to see. And for the Nevada State Public Health Lab, we're going to offer lab-based antibody testing, which means a blood draw would have to take place at a clinic, and the blood would be brought to us where we would run it on an instrument. I can't speak to who's going to be purchasing the point of care cartridges or where those will be at the moment. Emergency rooms might be one location, but again, because there's not a huge medical application for this at the moment, I'm not certain that will be the case.
Hi, Dr. Megan. This is Cynthia from KTVN, and I was just wondering, how soon will we see these antibody tests here in Washoe County or Nevada?
Laboratory-based antibody testing is going to start shipping next week. So labs that have elected, and I can't enumerate who those labs are other than our own, labs that have elected to run an antibody test and to offer that to clinicians in their jurisdiction, those should be starting to get some antibody tests, certain brands of antibody tests next week. One of the things that we really have to be cautioned about is the companies are saying these are shipping next week, but every single company that's providing a testing resource for COVID-19 is looking to supply the entire country. So what we're seeing whenever here in the lab, what we're seeing when new products are coming out, we're seeing very limited allocations of the number of, let's call it the ammunition that goes into those machines or the test cartridges. So even though these tests will roll out starting next week, the amount of testing that will be available to those labs that run those tests should be pretty limited for the next few weeks after that.
Hi, this is
Megan
Lucia.
Matherly at the.
Hi, this is Lucia Starbuck from This is Reno, and I was just wondering, do you have like a number of at least how many the Nevada will be getting?
I don't. I think we're instructed that it might start out to be just, and this is just, I really can only speak for the State Public Health Lab at the moment, which is our operation here, and we're hoping that what they're going to meet as an allocation would be around 100 of those tests per week for the first few weeks.
Thank you.
Any more questions for Dr. Pandori
Yeah.
before we move on?
Yeah. Hey, Dr. Pandori. Sorry, go ahead.
Sorry, this is Megan Messerly at Nevada Independent. I know at the beginning of this call you mentioned that the public health lab has capacity to conduct testing right now, but I know as we talk about what it would take to lift some of these social distancing measures, it seems like there's this general consensus that we still don't have a high enough level of testing to make that happen, right? As you mentioned, this is still, your doctor is ordering a test because they believe you meet the criteria for testing. So we know we're still not testing widely. I was wondering if you can give us a sense of sort of what level of testing we're at compared to, what we would really need to have this widespread level of testing that seems to be, the consensus that we need in order to go back to some semblance of normal life.
That's a great question, and it's one I'm hesitant to answer. I'd like to wonder whether the health officer for Washoe County, Kevin Dick, who's on the call, could speak to that as well. But we need a lot more. So right now, we don't have the capacity to test every asymptomatic person for which there's a rationale to test, like contact or potential contact. And I wouldn't even really want to put a number on it, except that, let's say that in mid-May, some of the equipment that we have should come online for testing, and it might quadruple our current ability to test. And when that happens, I would think that we should start to be able to do what's called surveillance testing along the lines of what you're suggesting. I would say, I'm not going to put an absolute number on it, but if we were to quadruple our throughput here at this lab and several other labs, that we would be approaching a moment when we could start to screen well beyond just contacts of known cases and symptomatic people.
Any final questions before we move on? I know we have about 15 minutes left. I know there's some questions for the incident commander. So we'll cut Dr. Pandori off if there's one final question. Okay, thank you, Dr. Pandori. Appreciate your time very much.
Thank you.
And we'll turn now to the Washoe County District Health Officer, Kevin Dick, for an update from health and remarks from him. Thank you.
Yes, good morning, everybody, and thank you, Adam, and thank you, Dr. Pandori, for joining the call today. Dr. Pandori and his staff at the state lab have done an excellent job in maintaining testing capacity over there. And as he discussed with you, in manufacturing the test collection kits in order for us to continue to be able to conduct sampling and working with a lab for testing for people in our community. So many thanks, Dr. Pandori. I have updated case count information for today. We have 17 additional cases, and that brings our total case count to date to 549. We sadly had an additional death that we reported, so our deaths are at 14 now for Washoe County. We have 11 additional recoveries, so we've surpassed 100 people who have recovered. Our recoveries are at 103 today, and so our total number of active cases is 432. We currently have 32 individuals hospitalized, and we have 41 individuals that have been discharged from the hospitals. Our hospitals continue to have very good capacity for care. The 54% of our licensed and staffed acute care beds are available in our short-term care hospitals. 49% of their intensive care unit beds are occupied, and 23% of ventilators are currently in use. Let me back up. I just want to make sure I said that properly. The 54% is the occupied acute care hospital beds. Our drive-through sample collection through our post is occurring today, and we're anticipating collecting 275 samples or more. We had a large surge yesterday in people that were accessing our online risk assessment forms in order to be scheduled for testing. So I wanted to thank the media for the coverage that you provided on Monday of our post operations. I think that helped to make people aware and drove additional people to our website. And we scheduled about 450 people for testing through the website visits. Remza, who's working with us on the call center, fielded 202 calls for risk assessments yesterday. So we have also been working with the Nevada National Guard and met with them yesterday and are working with them to have them integrate into our post operations for the testing, and also to provide us some additional support that's required for scheduling that we do and follow up with test results for people that are coming through that testing. I wanted to also touch on the numbers that we're reporting. I'm aware that yesterday the Southern Nevada Health District began posting maps of cases that they had by zip code area. We don't currently have plans to do that, but we're looking into posting by where they're located as far as cities that Reno, Sparks, et cetera, where cases may be occurring. And the reason that we're not inclined to pursue the mapping by zip code area is because those locations only provide the location where the person has a residence is isolating while they're recovering from the disease. It doesn't represent where we have spread occurring in the community. They may live in Reno, they may have been at a facility in Sparks where they were exposed, et cetera. So we believe they may create a false sense of security for people in some areas. And we believe it's most important that everybody in our community recognize that we have COVID occurring throughout the community, and to be assuming that they need to be taking precautions to avoid getting the disease. They need to be taking precautions to avoid spreading the disease. Therefore, the stay at home For Nevada message, the only go out for essential reasons, the cover your face with a cloth when you're out, and the hand washing and proper sanitation and cleaning of high touch surfaces. As far as information on demographics of the people that we have worked with for testing through our post, we made a conscious decision early on that we did not want to establish any barriers or discourage anybody from being tested. So we focused on collecting information that was pertinent to the risk assessment to determine whether it was appropriate for those individuals to be tested. Here at the Health District, we're quite aware of fear that certain portions of our population have in regard to accessing government services and how that has been enhanced by the public charge rule that could be an obstacle for somebody to be able to have citizenship in the future if they've accessed public services. So we know that that's had an impact on how people access the health district services. And so we had made a decision not to ask for race and ethnicity, and that data is limited currently in our database. We're working to increase the collection of that information through our risk assessment process. But as we do that, we will provide an opportunity for people to decline providing that information. We want everybody who should be tested to be able to have access to that test without any fear of the process to get tested. And we also, so there's no documentation that's required for that, no insurance that's required for that. We want everybody to feel safe and secure in accessing those services. But we will work to provide information as we're able to pull that out of our database. With that, I guess I'll conclude, and if we want to take questions now, Adam, can do that. I guess maybe I'll respond to the follow-on that Dr. Pandori pitched to me on the testing numbers that we may need for our community, number of tests. And I agree with Dr. Pandori, what Dr. Pandori said. I think we want to continue to increase the availability of testing so we can test more broadly in our community moving forward. There are now some discussions going on of what's involved in reopening our economy. The American Enterprise Institute has a document out that talks about how they see the requirements for moving forward prior to having a vaccine available. And there's a Framework for America document that CDC and FEMA, I understand, have been working on. And these both emphasize the need for additional testing as we start to reopen so that we can take an aggressive surveillance stance in being able to identify where we do have COVID-19 cases occurring, and then taking the appropriate public health response to identify those cases, do the case contact investigations, do the isolation of confirmed cases, the quarantine of individuals that may have been exposed as the follow-up. So I'd like to point out that not only requires additional testing capacity, but that also requires additional public health resource capacity as far as epidemiologists and case contact investigation staff that will be necessary to maintain that level of surveillance as we go forward. And I think that's important for everybody to understand, particularly given that Nevada is 50th in the nation in state funding for public health. So hopefully, as we see the response to this, we'll see availability of additional federal dollars and resources to help support the enhancement of the public health agency capacity that we're going to need moving forward until we get through the vaccine development. And I think coupled with that, people should understand that when we do start reopening stuff, it's going to be a gradual process, I would predict, and not one where at a certain date everything is back open. It's not going to be back to normal. It's going to be a new normal working forward, where we're continuing to have approaches for social distancing and keeping ourselves protected and protecting the spread, but perhaps not as draconian as some of those measures are right now. So
thank you, Kevin. I do have a few questions I want to get out. A few of you need to drop off. So a question for our incident commander, who's on have video capability right now. Apologize for that. But if you can take a question for News 4 for us. And then Scott Sonner with the AP, I know you have some questions, so we can get you on deck, get your questions out after this as well. Start with News 4. How far ahead does a decision for more or less beds have to be made? Is it strictly based on an analysis of future models and any plans for more beds anywhere else? So again, I believe we have Deputy Incident Commander Scott Stevenson on the line. Scott, you with us?
I am. Good morning.
Good morning. Did you understand the question, sir?
I did. And all of our decisions at this point are being made with the most current models, which change daily, and also the local trends that Kevin has talked about and that are talked about daily. The convention center is the only place that we're planning on building out if we go forward with that. Again, we're making decision points and basing all of those decisions to go forward with how many beds we build out and when we build them out on all of the current modeling and the current local trends.
Scott, I think we have some similar questions from the Associated Press. Scott, I know you're on the line. Scott Sonner, Scott, you wanna go?
Yes, I had a couple questions. Is there any estimate on a range of costs from a minimum and maximum build out of the convention center? And the follow-up would be, my understanding is we began all this in the neighborhood of between 1,100 and 1,200 acute care beds in Washoe County. Is there any sort of estimate of a worst case scenario about the number you're going to need to add? Let's go with that.
This is Scott again. The numbers that we base this on were based upon the numbers that we get from the local hospitals and their surge capacity. Their surge capacity has greatly been greatened by the build out of the parking garage at Renown Hospital, which they have not put a patient in yet. Therefore, our build out of the convention center would be done in a modular fashion with 250 rooms per modular piece, if you will. And that would go up to, I don't have the exact numbers, but it would be thousands of beds that we could put into the convention center if need be.
And estimated cost, worst case?
I can't really quote a top number. There is numbers that are in my mind right now. I forget what the exact total cost would be to build out the entire convention center.
We'll get a number for that for you, Scott. I believe it's about $9.5 million, but we'll confirm that. Full build out. Does that answer some of your questions, Scott?
Yeah, I guess the only other one in general of projections, I know it's very difficult. There are different models, but under the worst case and best case, what's sort of the range of a surge projection countywide?
Perhaps I could take that one, Adam. This is Kevin Dick.
Go ahead, Kevin. Thank you.
So we're watching the models and projections, and there's a wide variation in them, and things change day by day as we have more information about the disease and more information about what's actually happening with our actual numbers here in Washoe County. And so I think the good news is that for the models that we're looking at, the projections of worst case scenarios have been reduced over time as we've moved forward and seen what our data has been. And I think that indicates that the sacrifices that we're making with our social distancing strategies are helping to flatten the curve and preventing our surge scenarios from being as bad as they were a week or two ago. At that point, we were looking at overload of potentially several thousand beds in our hospital system. And we're down, I would now, with some of those numbers, into the hundreds of beds. The caution, though, that I would make is that these are just models and projections, and they don't determine what our actual number of cases are going to be. And so we need to continue to watch what's happening and developing in our region as we're making our decisions. There's no assurance that the model is correct and it's not going to be higher than what's being projected. But we're cautiously optimistic right now. And I think that the week ahead of us is going to be important to be watching and seeing where our numbers go.
Thank you.
I also have a question from 2 News for you, Kevin. In Washoe County, are we getting regular shipments of tests? And what's our supply look like right now?
So as I had mentioned, the Nevada State Health Lab has done an excellent job in being quite innovative and creative in their approach to ensure that they are continuing to receive the supplies that they need for their test kits. And they've continued to be creative in how they're approaching and manufacturing the test collection kits for us. So into the foreseeable future, we don't anticipate any reduction in that supply. We're also exploring and working on additional test capacity that would be provided through commercial lab testing. And we're working through that process and hope to have that available soon. That would not give us the type of turnaround that we've received from the state lab because of the requirements for shipping and the turnaround time at commercial labs. Continuing to explore how we might be able to develop additional capacity here. And then also we're working on identifying locations to deploy the Abbott rapid ID Now test units that we received, 4 of those here in Washoe County. They came with a very limited supply of cartridges that are needed to run the test. So we're also looking at how to increase the supply of our cartridges available there. But testing is something we continue to work on. It's a national problem with the available capacity. I think we've done a good job with this here regionally, and we'll continue to work to try to expand the availability of tests.
Thank you, Kevin. Any other questions?
This is Siobhan from the RGJ. I know resources are limited in terms of your investigators being able to trace where it's spreading, but anything that you've seen, how I know, like you said, you're not tracking zip codes because that's not necessarily where someone was catching it. Any other real strong indications of where this is spreading right now? Well,
there's already been in the news the 2 care facilities, the licensed care facilities of Willow Springs and the Lakeside Health and Wellness, and they account for a significant portion of the cases that we've had in Washoe County to date. But the other thing that I would suggest is for people that are working in the essential workplace environments, the importance of social distancing as you're working in those environments, the importance of wearing cloth coverings to prevent spread of disease. We have seen cases that are occurring in some of those facilities. So I think, and just out and about in grocery stores, as you're doing your essential errands, it's very important that you're protecting yourself and protecting others around you. The grocery store was one of my other questions. I know the governor's directive was that to really have that social distancing and have people monitoring going in and out. How is that going? Do you think at grocery stores? Is enough not being done in grocery stores? Are people wearing the masks? Do they have the shields up? Is enough not being done in grocery stores, or is it being done? So I haven't been in a grocery store since last Saturday, and I think where I was, they did have the shields up, and but they weren't screening people coming in. But I think it varies across the facilities in the county. I know it was a point of discussion for Reno City Council meeting on Monday, and we are actually having discussions with City of Reno today with the health district and their code enforcement people to talk about an approach for the grocery stores.
Perfect, thanks.
Hi, this is Lucia Starbuck from This is Reno, and just kind of talking about places like with outbreaks. I know in San Francisco in their homeless shelter, they had a huge outbreak, 90 folks, including 10 and then 10 staff. Are you concerned about that happening at the Reno Event Center? I know one person has tested positive who had slept there. Are you worried about seeing an outbreak there? There's about nearly 400 people sleeping in one room.
Certainly, we're worried about potential for outbreaks there and elsewhere across our community. But we have worked with the city of Reno, who's taken action to utilize the Reno Event Center in order to be able to create more social distancing, to spread out the homeless population that's sheltering there so that they are not in the closer confines that they had in the Record Street shelter facility. So that was a proactive action that was taken to try to prevent the spread of disease. We've also worked with the incident management team to have additional porta potties and hand wash stations put down around areas where we have homeless populations to be able to provide better sanitation opportunities for them. And so I'm grateful that we haven't seen an outbreak occur there yet. We've taken action to try to prevent that, and also to provide a place where we can move people to if they do have influenza-like symptoms and if they are suspected or diagnosed with COVID-19.
And the place where you're moving folks, is that the CIC campus, the Record Street shelters?
We have because of the Record Street shelter being not utilized for housing all of that homeless population, we do have places that on short notice we can move people there with influenza-like symptoms. But we also have facilities through WellCare that provide isolation location for people that are suspected COVID cases or if they're confirmed COVID.
Okay, thank you.
This is Kenzie with News 4 again. Seems that the state dashboard's a little bit behind. Do you have any updated numbers on that Lakeside Wellness and Willow Springs for us?
I don't have any updated numbers since the press opportunity that we did on Monday. And I don't have those numbers in front of me now to be able to provide to you. But the latest numbers that I had were the ones that I reported on Monday.
Thank you.
Any other questions for Kevin or our incident commanders?
This is Siobhan again. Just on the numbers that you give, how many ICU beds do we have here in Northern Nevada and how many ventilators? I know I see the percentages, but what are the actual numbers?
So I don't have those in front of me, but I'll work with Adam to get them for you.
Okay.
Those numbers are basically the number we have is the licensed ICU beds and licensed acute beds that we have in those hospital facilities.
And I know we're doing a good job of ramping up not ICU beds with the convention center and Renown. Is there a worry that we're going to become overwhelmed with just ICU patients?
So as the models, as time has progressed and we've had more of our real information to put into the models, the projections for the ICU surge have decreased. And so right now it looks like we're probably okay with ICU capacity with the surge plans that the hospitals have, but we're continuing to watch and we'll react as we see what develops.
Thank you, Kevin.
This is on with KUNR. I have a question about the facilities you mentioned, Willow Springs and Lakeside. So for the individuals who are living at those facilities and who tested negative previously, what is the protocol if they exhibit symptoms? Will they get testing, or is it just assumed because they live in those facilities that they've already been exposed? Like, how will we really know the true scope eventually of the infections there?
So the health district is not involved in the outbreak response in those facilities. Those are state licensed facilities. And so their staff are engaged with those facilities as far as the testing and the continuing monitoring for symptoms. So those questions would be best addressed to the state Division of Public and Behavioral Health.
Okay. Good. As we go forward, for our media partners, if you do have questions that do require a little research, numbers and that, if you could get those to us beforehand, that way we'll be a little bit in a better position to respond to you. And we would appreciate that. Just give us some time to do that. If there's no other questions, we will
Hey,
adjourn.
Adam.
Go ahead.
Adam.
Go ahead.
Scott Sonner, AP. One last follow-up. Are the ICU beds in addition to the other total beds, or are they a subset of those?
That's a good question, Scott. Those are a subset of the total acute care beds.
Okay.
Thank you.
Good question. Okay. I hope these are helpful. I believe we may have a representative from the city of Reno, particularly from the court side, or perhaps the city attorney. I'll confirm that. That may happen on Friday as our leading guest. There's some issues that we'd like to communicate to our media partners, and then we'll have Kevin Dick and our instant commanders on the line as well. So if there's no further questions, we'll see you Friday at 11:30. Thank you all.